Hi guys. My name's Sanjay Gupta. I'm a cardiologist in New York, and this is more than just medicine. So today I wanted to talk to you about common cardiological symptoms. Okay, a lot of people say to me, "Well, could this symptom be due to my heart? Could this symptom be due to my heart?" As cardiologists, we are mainly um, concerned about four sets of symptoms. Okay, the first is chest discomfort, um, and note I say chest discomfort, not pain. The second is breathlessness. The third is palpitations, and the fourth is dizziness or blackouts. So those are the four symptoms that uh, point towards the heart as a possible cause. Now, it's important to remember that there can be lots of different causes for each of these symptoms. They don't automatically have to mean that there's something wrong with the heart. And today I thought I'd just give you a few tips to help guide you as to whether your symptoms could be related to your heart or not. So the first symptom is chest discomfort, okay? Um, Now, the chest discomfort can be caused by a variety of different symptoms. Remember, the chest wall itself can cause discomfort. Underneath the chest wall, you have the food pipe, and if you have reflux, that can cause chest discomfort. Of course, you have the heart, and that can cause discomfort. You have the lungs, and that can cause discomfort. Also, the stomach can cause discomfort, and that can be referred to the chest. So there are lots of different reasons for chest discomfort. In terms of heart discomfort, in terms of discomfort that is caused by the heart, the first thing to understand is it's often not a severe pain. A lot of people say, "Oh, I didn't have any severe pain, but I did have discomfort." Yes, it is often a discomfort, okay? It can be a tightness, a heaviness, a burning even, but it is usually sort of not localized. It's generally all over the chest. A lot of people seem to attribute the radiation of the discomfort down the left arm as a major sign. That can happen with a lot of other things as well, and does not automatically mean it's the heart. But equally well, if you don't have it down the left arm, that doesn't rule out the heart. So the important thing is it's discomfort. It can go to the left arm, it can go to the right arm, it can often go to the back, it can often go to the jaw. Usually the discomfort comes on exertion and gets better with rest. That is called angina, okay? However, sometimes people can get it at rest, and that's very serious if it's coming from the heart, because it could indicate a heart attack. And the way you recognize this is firstly to understand that heart attacks tend to occur in people with lots of risk factors. Of course, they can occur in someone who doesn't have risk factors, but generally they're uncommon. So if you're below the age of 40, if you're completely well, if you have no other symptoms, if you're getting a localized sharp discomfort which is stabbing in nature or lasts a few seconds, then it's unlikely to be the heart. If on the other hand you're 70, you're overweight, you've smoked in the past, you have diabetes, you have high blood pressure, and you get this heaviness in your chest, please don't attribute that just to indigestion or something else. It's important to get checked out immediately, because if you're getting heaviness with those risk factors, then it's a lot more likely to be the heart. Often, if it is heart attack discomfort, then people will feel horrible. They feel nauseous, they feel clammy, they can feel dizzy, they can feel breathless. And one of the hallmarks from my side when I go into an emergency room and get called to see a patient with chest discomfort is that I can tell because they look grey, they look awful. The color is horrible, they look slate grey, and they're in discomfort. They're not necessarily complaining of severe pains. So that is the kind of discomfort that people get when they're having heart attacks. There's another, and if you get similar discomfort, not to that extent, but brought on by physical exertion, which gets better with rest, then that can be due to something called angina, i.e. the heart is suffocating because it's not getting as much blood. But if you slow down your activity, then the heart's not working so hard and the heart will get blood and the symptoms will get better. Both those sets, the angina, i.e. the discomfort on exertion, or the severe discomfort at rest that I've described, need urgent medical attention. and you should not delay this. You should go and see a cardiologist. All right. A lot of people come to me and say, "Oh, it felt like indigestion." Well, if it's occurring at rest, if you have the risk factors, then you shouldn't wait till the next morning. You should seek help straight away. The second thing is breathlessness. A lot of people talk to me and say, come to see me, and they say, well, I'm getting breathless. How do I know it's the heart? One of the hallmarks of breathlessness, when it's coming from the heart, is it's brought on by physical exertion and gets better with rest. Okay, if that happens, then that can sometimes signify the heart. If you have heart artery narrowings, that can make you breathless, but again, on physical exertion, gets better with rest. Heart-associated breathlessness doesn't really cause as much of a wheeze as lung-induced breathlessness. Often people who have a condition called heart failure can get breathless, but again, it is exertional breathlessness, and it can often be associated with breathlessness when people are trying to lie flat. And a lot of people will say, oh, I'm having to prop myself up at night because I'm getting breathless, and I've noticed my legs are swelling up, and I notice that when I walk I get breathless. That can be a sign of heart failure, and that certainly needs you to go and see your GP and maybe be referred to a cardiologist. The third symptom I wanted to talk to you about is palpitations. All right. Now, palpitations, what they mean is that is an awareness of your heartbeat to the point it feels abnormal. It can be a variety of different sensations. It can be fluttering, it can be skipping, it could be thudding, it could be a fast, irregular, chaotic pulse, it can be a fast, regular pulse. These are all palpitations, and they don't necessarily have to signify that there's a problem with the heart. They can just happen because a person is anxious or stressed. The hallmark of heart rhythm problems is that the palpitations come on suddenly, like a light switch, and they tend to go off suddenly. So the onset and the offset is very useful. Usually, when it's happening, the heart rate just shoots up. It's unusual that the heart rate will go from 70 to 80 to 90 to 100. With heart rhythm disturbances, the heart rate may be 70, and then suddenly, like a light switch, it goes up to 150, 160. And when you feel your pulse, it may feel extremely regular, or it may even feel irregular or chaotic. But those are signs of a heart rhythm disturbance. If you feel that your heart is going up slowly, it is associated with the stress or some kind of anxiety, and it goes away slowly, then that is less likely to represent a heart rhythm disturbance. All right. And then finally, there is the dizziness and blackouts. And again, dizziness and blackouts can happen because of a variety of different things. They can happen because of the blood pressure falling. They can happen because the person is anemic. They can happen for a whole raft of different reasons. But one of the hallmarks of blackouts or dizzy spells, which is related to the heart, is that it's very sudden. You don't get an aura. A lot of people say to me, well, I felt my vision getting blurred, I got some buzzing in my ears, I became clammy, I slumped, and I may have lost consciousness, and then I was helped up. That's unlikely to be the heart. That's more likely to be something called vasovagal syncope. With the heart, it is really a case of, like a light switch again, lights out, because heart-associated blackouts are usually because of a heart rhythm disturbance, either a very slow heart or a very fast heart, and therefore it occurs like a light switch. A person is fine, and then bang, they're either on the floor or they suddenly feel like they've completely zoned out for a second, and if that continues, they fall, and if they fall, they often injure themselves. So that is one of the other things that I look for when I'm worried that it could be due to the heart. So I hope this was helpful, and if you found it useful, please subscribe to this channel. We hope to put out a lot more videos on heart conditions, on gastric conditions, and anything else you want. But our aim really is to give you high quality information and reassurance so that you're able to manage your symptoms until you can go and see a doctor. So thank you so much. All right, bye.